Heath Ledger, Sigmund Freud, Elvis Presley, and Prince. What do these people have in common? They all died from an overdose of prescription opioids. Even the highest and most elite of our society are susceptible to drug abuse, just as we are in this room. The overuse of prescription opioids is rapidly becoming an epidemic that directly affects Minnesota. Today, I will first talk about what opioids are and how they affect the body. Then I will talk about how the use of these controlled substances spiraled out of control. Finally, I will talk about what is being done on both national and state levels to combat this epidemic. So first, I want to talk about what opioids are. Opioids are a unique drug, but some people do still not know what they are. Opioids are a class of drug that are made from a chemical compound found in poppies. This compound is called opium. The National Alliance of Advocates for Buprenorphine Treatment, an organization dedicated to educating the public on opioid abuse, on their website in April of 2016 explains what happens when opioids enter the system. They attach to our neurons. They can do this because they mimic the natural structure of our neurotransmitters. However, the signal that they send is much different than our natural signal. This causes the opioid effect. This floods the system with dopamine, which is a chemical that is usually associated with positive emotions, like happiness. Because of the flood of dopamine, it causes several symptoms, including slow breathing, euphoria, sedation, and it blocks the pain receptors in the body. This was introduced into modern medicine, according to Grace Newick, a Yale graduate with degrees in biochemistry and biophysics for Yale Scientific in January of 2017. She says that it was introduced into modern medicine right after the First and Second World Wars. This was because soldiers came home from the battlefront with gruesome and irreparable wounds. Along with that came pain. And the medical field needed a quick and a solution fast, so without long-term testing, opioids were put on the market. Now that I've talked about what opioids are and how they came about, we can start to understand how they became an epidemic. According to Lori Swanson, the Minnesota Attorney General, from the Office of the Minnesota Attorney General, on November of 2016, the U.S. uses up to 80% of the world's opioids, despite having only 5% of the world's population. This can be traced back to the 1980s. Pamela Luang, a pharmacist and researcher for the New England Journal of Medicine in June of 2017, did a study on a letter that was published in the New England Journal of Medicine. This letter was about a study that found addiction rare in the study that they had done on opioid patients. Luang and her team wanted to see the effects of this, and they found that this letter was cited over 400 times, and in 72% of those articles that it was cited in, it was used as evidence that opioids were not addictive. By the time this was corrected, from 1999 to 2015, 183,000 people had died in the United States from opioid addiction. That's 31 people every day for 16 years. Minnesota is also seeing these numbers. According to Lexi Reed Holtum, the founder of the Steve Remler Hope Foundation for the Minnesota Department of Health in 2016, the numbers of deaths in 2015 in Minnesota were 4 times that of the numbers in 2000. Our Attorney General expands on this, saying that the number of just adolescent deaths over 15 years was 322. Now that you know what the epidemic is, we can talk about what is being done on both national and state levels. In 2016, the CDC released guidelines that discuss when to give prescriptions, the details of the prescription, and the risks of using opioids for a treatment. Along with the CDC, the United States Food and Drug Administration is denying access to new products that are being put on the market. Minnesota is also taking their own measures to do this, and as of July of 2017, they have adopted a program where all prescriptions must be monitored by both prescriber and pharmacist. The Minnesota Department of Health is encouraging the use of naloxone, which is a drug that counteracts the effects of an opioid overdose for a short time for emergency responders to get to the situation. Today I've told you about what opioids are, how they became an epidemic, and what is being done on both state and national levels to counteract it. Opioid overdose is becoming an epidemic that is directly affecting Minnesota. At the beginning of this speech, I told you 4 names of people who had died from opioid abuse. Now I have 4 names for you. Jamie Lee Curtis, Kelly Osborne, Steven Tyler, and Matthew Perry. These 4 people were once addicted to opioids as well, but they succeeded in getting help and overcoming their addictions, and now they advocate for those who did not make it past the epidemic. But the most important question is, will you advocate?